The following is a segment from a Mutare-sponsored webinar on the FCC's Hospital Robocall Protection Group findings, detailing the specific threats and actions needed to combat fraudulent robocall activity within healthcare organizations. Visit our YouTube channel for the full presentation.
I think it's natural to go right into the mitigation aspect of it. Once we're aware, now what do we do?
Right. So really, again, two broad categories here, what a hospital can do for mitigation once they understand that they're being targeted by these calls, really internal methods and then external methods. And then really try to understand within your telecommunications department, what are your own internal robocall blocking capabilities internally, then working with your voice service provider externally, what are their capabilities, but absolutely making your voice service provider aware of the situation. Again, it'll help them connect the dots if they see multiple hospitals or multiple organizations receiving similar spoof calls from perhaps originating same number or same technical information. That'll help them block on a broader scale. Again, identify those fraudulent disruptive calls, logging all that information, getting into telephony management internally, and then understanding what the availabilities are internally and externally to block your number being spoofed. As you said, Rebekah, you can't do anything about that internally. That's where you got to work with stir shaken capabilities and working with the providers. Segregation of numbers, again, technical issues that you can do here. Identify the configuration of the critical and non-critical lines in a hospital. So just like you would identify critical data, critical assets in a hospital, identify those critical lines, and that's where you want to build at least your strongest defenses around those lines there themselves. And then again, once you've evaluated the calls, evaluated the event, then that's where you're going to try to implement those controls, again, internal and external, working with the voice service provider. And the plan, just like you would have a cyber incident response plan, which would encompass all the required entities within your hospital: legal, compliance, communications, technical folks, telecommunications, even your information security teams. You should have a similar, as you said, Rebekah, matrix, making sure that all those folks are notified appropriately, timely, and they have specific roles and delegation of authorities that they should check, because this will recur. And again, lots of these similar procedures are already in place in hospitals for breach reporting, for cyber incident reporting, in their general, even emergency management teams and incident command systems. So these are things that can already be leveraged. And then at that point, the decision should be made, once you fully evaluate the event, to contact appropriate state, federal, law enforcement, and regulatory authorities.